Hey everyone, Dr. Geyer here. I wanted to start to share some of my game changers in clinical practice because there's a lot of things that happen in my clinical practice, and I think, oh, this is happening everywhere, right? All the doctors are using this, and people are aware, and I kind of take it for granted. And then I realize actually not that many people are blending all of the amazing technology and science and advances in medicine that we have out there for their patients. A lot of them are still doing the same thing that they were doing 10 years ago and 15 years ago and 30 years ago. So medicine has a way of being really slow to learn things, which the last couple of years have taught us. So I wanted to talk about my favorite game changers, and we're going to start with the continuous glucose monitor. Now, I started using this in non-diabetic patients or non-type 1 diabetic patients probably about a year or two ago. Before that, I really also knew it just for type 1 diabetics. What this means, a continuous glucose monitor continuously monitors your glucose, right in the name. And they have electrodes now, so it's like a little sticky electrode. It's got a tiny itty bitty little needle that people can't feel coming out of it. And it stays on the skin and it'll monitor their glucose over time. Why this is important is, one, it eliminates the need to keep pricking people's fingers, which has been, huge and a game changer for type 1 diabetics. But that's also really important for people that are having hypoglycemia or having hyperglycemia or those roller coasters. There's riding the roller coaster of their blood sugar, but they're not a diabetic. They're not a type 1 diabetic. They're not a type 2. They're not pre-diabetic yet, maybe. Or maybe they are and they don't even know it yet. The other kind of key pieces that I use it with is when people are having trouble with their weight or they're having trouble with their other hormones, because all of these hormones are talking to each other and blood sugar is part of that. So let's say I have somebody with polycystic ovarian syndrome. Blood sugar is a key part of that syndrome. Having had PCOS myself, I rode that roller coaster for a really long time. There are so many ways that blood sugar comes in, and we can really optimize it. The other key piece is this person over here and this person over here are going to respond completely differently to food. So I burst a lot of bubbles this way because people think, oh, well, I eat healthy, or this is the understanding, or this is the glycemic index. And that doesn't really work. Like, that's really kind of old knowledge. The way that I respond to one food and my husband responds to that same food and my kids respond to that same food is actually different because we're biochemically different, we're genetically different. And so those are a lot of things that I bring into my practice with my patients. But I really kind of want to focus on what data that we can get from this and how it's going to change a lot of people's lives once they know about it and they're using it. So the first thing is there's lots of these monitors out there. I use the Freestyle Libre. I really like the 14-day because I am all about ease. So this particular one you put in place, and it'll stay in place for 14 days as long as you don't get it too wet or it doesn't knock off. And we'll talk about placement and ways to keep it in place and optimize it for that 14 days later. The other key pieces I really like is it eliminates your need to prick your finger, which is really nice. They have both a glucometer and an app for your phone, so you can actually download an app to your phone. And the app for your phone, you can swipe it anytime you want, so you just kind of run it past and check. So I often have people check it when they first wake up or before they eat, 1 hour after they eat, and 2 hours after they eat. So that's how I often utilize it, or anytime they're not feeling well, to see if their blood sugar just changed drastically, up or down. Maybe it's still in a normal range, but maybe it just changed and they're having a hard time with that change. They can log their food directly in that app, which is really cool. And they can also share their information with me. So as a clinician, I have a portal on my side where I can invite patients over, and then I can see their trends. I can see how many low blood glucose episodes they had. I can see how things are working over time, and then we can really sit down and dial it in for them. So those are a few of the reasons that I really like continuous glucose monitors. Like I said, they're super easy. They eliminate the need to keep pricking your finger. They are 14 days. Depending on which one you get, I get the 14-day Freestyle Libre. Sometimes they are covered by insurance, sometimes they are not. So I'm always really clear about that. If you're a type 1 diabetic, yes. If you're a type 2 diabetic, sometimes depending on your insurance plan, and sometimes they have to go through a medical device company. If you are pre-diabetic, oftentimes they do not get covered by insurance. If you're having hypoglycemic episodes that are proven, then sometimes we can also get it covered. Here's the other key piece is, I just had this recently where a doctor told someone that they couldn't get it covered by insurance, so they wouldn't prescribe it. Any physician can prescribe this and you can cash pay, and they're not that expensive for the amount of information that you get. So it's about $125. Shop around. It's considered a medical device. You can't look at GoodRx, but you can shop around, look at Costco, Walgreens, CVS, Walmart, whatever you want to do, and take your prescription anywhere and get, the least expensive price that you can. So yes, you can also still get it, even if your insurance doesn't cover it. So that's a few of my highlights of how I use it, and why I love it so much. And it's absolutely changed the way that I recommend things for patients and how we treat them for their blood sugar, their mood, their weight, their hormones, all sorts of things. So I hope that was helpful, and I'll make a few more videos here for my game changers and a couple more for the continuous glucose monitor. Have a beautiful day.